Good morning students. At the time of the examinations may ask viva questions how to identify the muscles. So this is the pectoralis major muscle after separating from the trunk or the body upper extremity. This is the pectoralis major. How to identify it? First the nipple. This is the landmark to identify the pectoralis major muscle. You know it is a fan shaped muscle. It takes origin from the sternum, lateral border, ribs as well as the clavicular part. This is the clavicular part. Insertion at the lateral lip of the bicipital groove. This is the insertion of the pectoralis major. This is the pectoralis major. See how it is insertion. Pectoralis major identification. After reflecting this, below we can identify it is look like a triangular shape. Pectoralis minor muscle. It takes origin from the ribs. It is going to insertion at the this is the tip of the coracoid process. We can feel it. This is the tip of the coracoid process. Not only this pectoralis minor muscle insertion, it also gives origin for the short head of the biceps brachii. See, this is the short head of the biceps brachii, coracobrachialis muscle. See, this is the coracobrachialis muscle. Coracobrachialis, short head of the biceps brachii muscle. These three structures attached to the coracoid process. These two muscles present in the pectoralis region. Next, another one scapular muscles. Next continuation. See, this is the scapular muscles. Here, first you identify the spine of the scapula. Spine of the scapula. This is the landmark. Above the spine, here we can identify the supraspinatus muscle. This is the supraspinatus muscle. Above the spine is the supraspinatus muscle. Below the spine is the infraspinatus muscle. This is the infraspinatus muscle. Supraspinatus, infraspinatus. Next here we can identify the teres minor muscle. Here we can identify the teres minor muscle. Here this is the teres major muscle. This is the teres major, teres minor muscle. So below the spine, infraspinatus, teres minor, teres major muscle. Supraspinatus above the spine. And also here we can identify superior angle region, levator scapulae muscle. Levator scapulae. Next to medial border region. Here rhomboides major, rhomboides minor muscles. These are the two muscles. Rhomboides minor, rhomboides major muscles are there, going to attach to the medial border of the scapula. Next, whereas the subscapular region, first many students confused to this may say subscapularis muscle. It is wrong. It is serratus anterior. After reflecting this serratus anterior muscle, below we can identify the subscapularis muscle. Subscapularis muscle. Subscapularis muscle. Serratus anterior muscle. This is the serratus anterior. Next, shoulder region. Shoulder region mainly. See, this is a deltoid. See how it is. Just off shoulder region muscles. Mainly deltoid. This is the deltoid muscle. This is the deltoid muscle. It having the these are the anterior fibers. This is the lateral fibers. These are the posterior fibers. So posterior fibers, lateral fibers, and anterior fibers. See how it is. It is look like a triangular or deltoid shape. These are the anterior fibers. These are the anterior fibers. This is the lateral fibers. These are the posterior fibers. Posterior fibers separating from the spine of the scapula. Lateral fibers separating from the acromion process of the scapula. Anterior fibers separating from the clavicle. After separating this, we can identify the deltoid muscle. It is a multi-pennate muscle. Remember this. Multi-pennate. Anterior and posterior fibers are the unipennate and lateral fibers are the bipennate muscle. So this is going to insertion at the deltoid tuberosity. Exactly, it is present at the mid of the shaft. shaft region there is a V-shaped tuberosity is there, that is called the deltoid tuberosity, tubercle. So it is going to insertion here. The nerve supply mainly here axillary nerve. The nerve supply of the deltoid is axillary nerve. It is mainly useful for the abduction of the shoulder joint, abduction of the shoulder joint. After reflecting this, we can identify this, the capsule of the shoulder joint, capsule, head of the humerus is here, and also acromion process, and also here see supraspinatus here, infraspinatus, teres minor. These three muscles going to insertion at the sit muscles like a supraspinatus, infraspinatus, teres minor. These are the three muscles going to reach to insertion at the greater tuberosity, that is the greater tubercle of the humerus. Before going to insertion, it make a single tendon, it acting like a secondary socket to the shoulder joint, that is also called the rotator cuff. Rotator cuff. This is we can identify. After reflecting this only, here we can identify the spaces are there, quadrangular space, upper triangular space, here lower triangular space is there, lower triangular space here, lower triangular space, quadrangular space, upper triangular space is there. These are the shoulder region. Next, arm region. Now arm muscles, mainly biceps brachii. This is the biceps brachii muscle. See how we are lifting the biceps brachii muscle. Biceps, why we are calling biceps? It having the two heads. This is the long head of the biceps brachii. This is a short head of the biceps brachii. It takes origin from the coracoid process. Long head, it enter into the bicipital groove and capsule. It takes origin from the supraglenoid tubercle or tuberosity. This is the long head of the biceps brachii. This is a short head of the biceps brachii. After coming downwards in the middle of the shaft, fuse together to form a bulky mass. Biceps brachii. It is going to insertion at the radial tuberosity. Here radial tuberosity is there. Radial tuberosity. This is the biceps insertion. After lifting this below, we can identify the nerve. See what is this nerve? Musculocutaneous nerve. Musculocutaneous nerve. See how it is. Musculocutaneous nerve. This is a muscle is coracobrachialis. Coracobrachialis. The nerve which is pierce the muscle. That muscle is coracobrachialis muscle. The nerve is musculocutaneous nerve. This is the musculocutaneous nerve. See how it is going to supply to the biceps brachii, coracobrachialis and brachialis. See, this is a brachialis muscle. After lifting this biceps brachii, we can immediately identify the brachialis muscle. So very easy to identify brachialis, biceps brachii, coracobrachialis. Next, posterior compartment. Here triceps brachii. This is the triceps brachii. This is the long head of the triceps. This is the long head of the triceps. Lateral head and medial head is there. So whole posterior compartment of the arm region covered by only one muscle, that is the triceps brachii. This is the triceps brachii muscle. So after cutting this lateral head of the triceps brachii, we can identify here radial nerve, spiral groove. In the spiral groove, radial nerve is going. Not clear. Brachii. Cubital fossa. See, elbow joint region. Cubitus means elbow. Here we can identify triangular fossa, laterally bounded by brachioradialis. This is a brachioradialis. This is a brachioradialis, lateral side, and medially bounded by this is the pronator teres. This is a pronator teres muscle. Where these two muscles coincide, that is called the apex of the cubital fossa. Next here, medial epicondyle and lateral epicondyle. If you make a one horizontal line, this is called the base of the cubital fossa. Medially by the pronator teres, laterally brachioradialis muscle. So this is the triangular area is known as the cubital fossa. The contents are from medial to lateral side. See, median nerve, this is the MBBS. M means median nerve, B means brachial artery, B means biceps tendon, S means superficial branch of radial nerve. These are the contents of the cubital fossa. See, MBBS, M median nerve, B brachial artery, B biceps tendon, S medial cutaneous branch, superficial branch of the median nerve. See how from medial to lateral side, M means median nerve, B means brachial artery, B means biceps tendon, S means superficial branch of the radial nerve. These are the contents of the cubital fossa. Very frequently asking in the viva. Remember this. Next, this is the flexor compartment of the forearm muscles. These are the flexor compartment of the forearm muscles, superficial deep muscles. From lateral to medial side, see, this is the pronator teres. Pronator teres muscle. Pronator teres. This is the flexor carpi radialis muscle. Flexor carpi radialis muscle. This is the palmaris longus muscle. Palmaris longus. This is the flexor digitorum superficialis. Flexor digitorum superficialis. Next, towards the medial side, flexor carpi ulnaris muscle. This is the flexor carpi ulnaris muscle. Flexor digitorum superficialis, palmaris longus, flexor carpi radialis, pronator teres. These are the 5 muscles having the common origin, that is the medial epicondyle of the humerus. After lifting these muscles, here below we can identify the deeper muscles. See, flexor digitorum profundus. This is the flexor digitorum profundus. And also here median nerve. This is the median nerve also we can identify it after reflecting this. Next, below, this is the quadratus femoris, quadratus pronator. Another deeper muscle, pronator quadrant muscle. See here, pronator quadrant muscle. These are the deeper muscles in the flexor compartment of the forearm region. Here, thumb side, lateral side, here we can identify the radial artery and accompany with the radial nerve. See, radial nerve and radial artery. Middle one, median nerve, and medial side, here ulnar artery and ulnar nerve. Medial side, ulnar nerve and ulnar artery. So in the flexor compartment region, medial side ulnar nerve, ulnar artery, and the center median nerve. Lateral side, here we can identify the radial artery and radial nerve. These are the flexor compartment structures present in the forearm region. Whereas the extensor compartment of the forearm region, here from lateral to medial side, this is the brachioradialis muscle. See, brachioradialis muscle, extensor carpi radialis longus, extensor carpi radialis longus, extensor carpi radialis brevis. It is a deeper muscle. Brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, extensor carpi ulnaris. These are the superficial part of the extensor compartment of the forearm muscles. Whereas the deeper muscle, after reflecting here, see, here we can identify the anatomical snout box. See here, this is called the abductor pollicis abductor pollicis. So deeper muscles, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus. These are the three muscles. See how it is deeper muscles. Abductor pollicis longus, abductor pollicis brevis, extensor pollicis longus, extensor pollicis brevis, abductor pollicis longus. These are the deeper muscles, and also crossing at the thumb region, it make a anatomical snub box. This is a anatomical snub box. Base is found by the extensor retinaculum, posterolaterally bounded by the abductor pollicis longus. This is the extensor pollicis brevis, whereas the posteromedially bounded by the extensor pollicis longus, where these tendons insertion that make a apex of the anatomical snub box. So these are the contents we can identify, mainly radial artery continuation. See here, radial artery continuation, cephalic vein, and cutaneous branch of the superficial branch of radial nerve. This we can identify after reflecting this superficial branch. Next, hand muscles. Here there is a 20 muscles are there, 20 muscles. Thenar muscles, hypothenar muscles, 4 lumbricals, 4 palmar interosseous, 4 dorsal interosseous are there. This is a flexor pollicis brevis, abductor pollicis brevis. Below, opponent's pollicis is there, opponent's pollicis. Next here, adductor pollicis. Here, this is the adductor pollicis. Next here, flexor digiti minimi, abductor digiti minimi, opponent's digiti minimi. These are the 3 muscles present in the hypothenar muscles. Lumbricals. First lumbrical, second lumbrical. First and second is the unipennate. This is supplied by the median nerve. And third and fourth is the bipennate muscles here. And fourth lumbrical also bipennate. See here, bipennate. So third and fourth is the bipennate. It is supplied by the D branch of the ulnar nerve. First and second is the unipennate. It is supplied by the median nerve. Next, palmar interosseous 4, dorsal interosseous 4 muscles. After reflecting all tendons, deep dissection, then only we can identifying. So that those 8 muscles are also supplied by the D branch of the ulnar nerve. And not only this, and also in the hand region we can identify continuation of the ulnar artery, make a superficial palmar arch. Continuation of the superficial palmar arch formed by continuation of the ulnar artery. Deep palmar arch is continuation of the radial artery. Not only this, and also median nerve also we can identifying here. This is the median nerve and its branches. So finally I will tell simply now supply to all upper extremity. Here forearm region, lateral side, this half is supplied by the median nerve. This half medial side is supplied by the ulnar nerve. So this whole region is ulnar nerve. This lateral side is supplied by the median nerve. Next here arm region, this is supplied by the musculocutaneous nerve, whereas the posteriorly this is supplied by the radial nerve. Next deltoid, this is the shoulder region supplied by the axillary nerve. So axillary nerve, radial nerve, this is also radial nerve. So full from here to here it is the radial nerve. Extensor compartment, posterior compartment, whole extension of the upper extremity supplied by the radial nerve, whereas the flexor compartment, this is supplied by the musculocutaneous. Here it is divided into 2 parts. Laterally it is supplied by the median nerve, medially it is supplied by the ulnar nerve. Okay, it is useful for that at the time of the examinations go through this prosection of the upper extremity dissection. Thank you.